everyone. This is my final project. It is on autism spectrum disorder in women and girls. Here is an overview of what I am going to talk about in this presentation. Overall, the main issue with girls and women with ASD is that the number of boys diagnosed with ASD outnumber girls at a ratio of around 4 to 1. This gap may be even larger at the highest end of the spectrum, and it may be narrower at the lower end of the spectrum, as girls on the lower end of the spectrum are more likely to be recognized and diagnosed with ASD. Nobody's really sure why there's such a large sex ratio, whether it's because it's true that boys do have more ASD or are more likely to have ASD. There's a theory that maybe they're genetically predisposed to have ASD, but there's also another likely theory that women and girls with ASD are just not recognized much at this time, especially on the higher end of the spectrum. We're going to talk about the symptoms of ASD and the criteria you need to be diagnosed with ASD. We're going to talk about the history of ASD and how that relates to women and girls with ASD today. We're going to talk about how ASD is different in boys and in girls. And then we're going to talk about why there are more boys diagnosed with ASD than girls. And we're going to discuss what can we do to better help women and girls with ASD. Now, what is autism spectrum disorder? Autism spectrum disorder is a neurodevelopmental disorder that causes impairment in social communication and social interaction. It can also cause people to have restrictive, repetitive behaviors, interests, or activities. Their favorite interests or activities are to the point where it is hard to focus on anything else. And it is estimated that around 1% of the population has ASD, and there's no known cause for it. It may be genetic, or it may be environmental, or it may be a combination of both. It is typically diagnosed in early childhood. It can also be diagnosed during adolescence and adulthood when the social demands exceed their capabilities of functioning. Girls and women, they're much more likely to be diagnosed during adolescence or adulthood. Also, people on the higher end of the spectrum are much more likely to be diagnosed during adolescence or adulthood because they do not have the language delay that people on the lower end of the spectrum tend to have during early childhood. There's also a lot of comorbid disorders associated with ASD, and some of these include anxiety disorders, depression, and ADHD. Now, according to the DSM-5, there are certain diagnostic criteria for ASD, and you must meet this criteria in order to be diagnosed with ASD. For example, there must be deficits in social communication and interaction. So an example of this is deficits in social emotional reciprocity. This means that people with ASD are less likely to have a typical back and forth conversation with somebody. Their conversations might be more one-sided, or they might not even initiate conversations or be polite and ask people how they are doing because they might not recognize that they have to do that. There's deficits in nonverbal communicative behaviors used for social interaction. For example, they do not pick up on nonverbal social cues, such as gestures or facial expressions. They have deficits in developing, maintaining, and understanding relationships. Like they have trouble making friends and maintaining friendships or maintaining romantic relationships. Some of the other diagnostic criteria for ASD is restrictive, repetitive patterns of behaviors interests, or activities. And in order to be diagnosed with ASD, you must have at least two of the following. Number one is stereotyped or repetitive motor movements, use of objects, or speech. An example of this is lining up toys, flipping objects, or echolalia. Or for those who don't know what echolalia is when you repeat certain, or when someone with autism repeats certain phrases like over and over again, like regardless of whether or not they make sense in that context. Number two is they have a strong need for routine, they're inflexible to change, they have ritualized patterns of behaviors. For example, they like to stick to a routine, do the same things every day, maybe wear the same things every day, or eat the same things every day, and if you try to change that routine, they can get very upset and potentially have a meltdown. Number three is intensely fixated on a particular interest. Like a lot of them have like a special interest. Like, for example, some might be interested in trains or maps or a particular TV show or history. To the point where they can't really focus on anything else, or they'll just talk and talk and talk about it to the point where people lose interest. And sometimes, though, this can be turned into a career. For example, if someone's interested in history, they could become a historian or study history in college. Number four, there's hypo or hyper reactivity to sensory stimuli. For example, they might have an extreme reactions to tags in their shirt, or you could prick them and they won't complain, they won't feel anything. Some are not sensitive to pain at all, and that is something to be concerned about. The symptoms must be present in the early developmental period, or they can also appear when the social demands are very demanding, such as during adolescence, and people with ASD just can't cope with it. Also, they must cause clinically significant impairment in social, occupational, or other important areas of current functioning. And these symptoms are not better explained by intellectual disabilities or another kind of disorder. There are many red flags to look for when you think that a child has ASD. Some examples of red flags include frequent meltdowns, especially in response to change or transitions or sensory overload. Symptoms of ADHD. Sometimes this could just be ADHD. Sometimes it could also be autism. Or sometimes it could be both. But because, like I said, ADHD is a common comorbid with ASD. Extreme perfectionism, sensory issues, unusual fears, there are a lot of anxiety, like more anxiety than is typical for a kid. There's different behaviors at home that at school. They have trouble generalizing their behavior. For example, they can act appropriately with parents or have a good social relationship with parents, but not so much with students and teachers. Another thing is that they can interact well with adults, but not so well with their own peers. And this is especially common with people more on the higher end of the spectrum, and can also be common with girls. There's difficulty discussing their emotions and understanding the emotions of others, or understanding their own emotions. There can also be a lack of emotional expression or a lack of facial expressions, and
difficulty reading nonverbal cues and gestures?
According to the DSM-5, since they have eliminated Asperger's syndrome and PDD-NOS, they came up with a new system of 3 different levels for ASD, and the levels pertain to the amount of support or the severity of their symptoms that they present. Um, Level 1, that means that they require support. Um, Typically, people who are level 1 are more higher functioning, or they have a higher IQ, like they can talk well, but they have trouble making friends, or might have some anxiety, but other than that, they have a high potential to learn social skills and to be independent. Level 2, it requires substantial support. It's in between level 1 and level 3. Like, it's not as severe as level 3, but it's more severe than level 1. Like, they might talk, but more in, like, simple sentences, and they can get highly distressed when their routine is changed. And it's possible that they could live independently, but it's not as likely as a comparison to people on level 1. Level 3 is the most severe level. It means they require very substantial support. For example, some of them might not talk at all, or they could say a few words. They can be very distressed when their routines are changed, and can engage in a lot of dangerous self-harm. And most likely, people on level 3 will not be independent and will need to be taken care of for the rest of their lives. Now, in order to better understand why women and girls with ASD have been unrecognized and continue to go unrecognized, we first must look back at the history of ASD. Now, there's 2 men that helped to contribute to our understanding of ASD as we know it today. And these men are Hans Asperger and Leo Kanner. Now, Hans Asperger, he studied children in Austria during the 1930s and 40s, and he published his first paper describing Asperger's syndrome in 1943. And in his paper, he described 4 boys, and they were on the higher end of the spectrum, and they were highly intelligent, and he called them his little professors. And mainly in his research, he studied boys, and he was not even sure if girls could have ASD. However, he did notice that some of the mothers of the boys had autistic traits. However, he did not think that they had a full-blown case of Asperger's syndrome. Now, it is quite possible that at that time in Austria, there just were more boys than girls who had Asperger's syndrome. But also, another likely explanation for this is that a lot of the children that were referred to Hans Asperger were referred to him through the court system. And even at that time, women and girls were better at masking their symptoms of ASD, and they stayed out of trouble, and therefore were less likely to be referred to clinical treatment through the court system. Now, also around the same time as Hans Asperger, Leo Kanner was studying children with ASD at Johns Hopkins University, and he published his first paper on ASD in 1943. Now, the children that Leo Kanner studied, they were more on the lower end of the spectrum than the children that Hans Asperger was studying. And while Leo Kanner did study some girls, the majority of his patients were boys, and people went on to still continue to believe that the majority of people with ASD are boys. And for a very long time, up until the 1990s, before Hans Asperger's version of autism was discovered, Leo Kanner's autistic disorder was the gold standard for autism. Then in 2013, the American Psychiatric Association decided to merge Asperger's syndrome and Leo Kanner's autistic disorder, and also another disorder called pervasive developmental disorder not otherwise specified, into one spectrum disorder. Because after they've done some research, they realized that Asperger's syndrome and autistic disorder really are not that clinically or significantly different from each other, and it really is just one large spectrum. Now, one significant theory that contributed to the myth that women and girls do not have autism is the extreme male brain theory. Now, the extreme male brain theory was originally theorized by Hans Asperger. When Hans Asperger was studying boys with Asperger's syndrome, he theorized that Asperger's syndrome was an extreme variant of male intelligence. And now this theory about autism stuck around for a very long time, and 40 years later, there was a British psychologist named Simon Baron-Cohen. And Simon Baron-Cohen was one of the biggest proponents of the extreme male brain theory. And he theorized that autism could be caused by high levels of testosterone in the womb. And also, he came up with two kinds of brains. There's the systematic brain and the empathetic brain. And the systematic brain, he noticed, was much more common in males. And the systematic brain is good at coming up with systems and organizing things into systems and coming up with rules. And he noticed that the autistic brain was even more systematic than the male brain. It was an extreme version of the systematic brain. And whereas the other brain, the empathetic brain, was much more common in females. And the empathetic brain is much more better at empathizing with people and better at picking up emotions. And he just didn't notice that as much in the autistic brain. So he felt like the autistic brain was much more systematic. However, this theory has been widely criticized by researchers and psychologists today. They say it's much too simplistic, and there's much more variation in the male and female brain than he realized. And the female brain can be systematic, and the male brain can also be empathetic, and it's just not either one or the other. And also, a big thing about this theory is that it really discounts women and girls on the spectrum. Because while women and girls on the spectrum can be more masculine, they can also still be feminine and be empathetic, and they're not entirely systematic. There are many differences between boys and girls who are diagnosed with ASD. For example, the girls that are typically diagnosed with ASD tend to have a lower IQ than boys that are who have ASD. They also might be more prone to having seizures and epilepsy. Now, this does not mean that girls with ASD are less intelligent than boys. This just means that the girls with lower IQs are usually more likely to be diagnosed with ASD in comparison to boys. This is because the girls are much better at hiding their symptoms than boys, and oftentimes go unnoticed. And also, we were talking about the history of ASD. Girls with ASD just historically have not been studied that often, and people don't know what to look for when they're looking at girls with ASD. And because of this, women and girls, they're much more likely to be diagnosed later, such as they're likely to be diagnosed during adolescence. because during adolescence, the social demands exceed their capabilities of socialization, and they often struggle to socialize because adolescent behavior can be very complicated and it's much different than in elementary school, and they can have like much more symptoms then, and they're much more likely people are much more likely to pay attention to their symptoms at that time. Also, another reason for this is the girls tend to have more internalizing behaviors than boys, because the boys are much more externalizing behavior. Or what I mean by this is that boys, when they're angry, they might punch somebody or violently hurt themselves, and that causes people to stop and pay attention to them. Whereas girls, they their symptoms they're much more likely to keep their thoughts to themselves. Like they might have like a lot of negative, like anxiety kind of thoughts or depressed kind of thoughts, or they might engage in self-harm, but more in like a subtle way, and they're less likely to attack others. They're more likely to attack themselves before they'll attack others, and people might not pick up on that as much because it doesn't cause as much attention. Some other differences between boys and girls with ASD is that girls with ASD often use more facial expressions than boys. The girls are also better at mimicking the behavior of others, and they are much more chameleon-like, and that helps them to better pick up social skills. However, the drawback of this is that sometimes they have trouble forming their own identity, and they take on the identities of other people. Um, the obsessions that girls have are typically considered more normal than the obsession of boys. Like, for example, like we were talking about earlier, boys are more likely to be interested in things like trains or maps, whereas girls, they could be interested in like animals or celebrities or like a TV show or art or music, and these interests are considered normal for girls. Like they really wouldn't stand out that much in comparison to some of the interests that boys have. Uh, Girls are more likely to discuss their emotions than boys, and they're better at like understanding their emotions and understanding other people's more emotions. They're more physically expressive than boys. When girls have meltdowns, they're much more likely to cry than boys, and they're more likely to cry in public than boys. Boys don't cry as much as the girls. People have higher expectations for girls with ASD because they appear to be like higher functioning, or they appear to be more socially competent. So people are sometimes less understanding when they say that they have ASD, or when they say they're struggling socially, as in comparison to boys is much more noticeable, and people are more likely to understand their social issues. Um, Females with ASD, they strongly hate injustice and misunderstandings, and they try to correct that, and they can sometimes have meltdowns when they feel that there's an injustice going on. In comparison to boys, girls are also less likely to stutter, and females can socialize better than males, but more in like small doses. In small doses, it's kind of like acting or performing. They can perform for a short time and socialize, but after a while it can get overwhelming, and if they don't get enough self-care, they could have a meltdown. Um, Also, females are much more likely to keep pets for emotional support, and they're not just for sensory support or sensory issues. And because that's like another obsession of theirs. They can be obsessed with animals. There are many traits and signs to look for when you suspect that a female might have ASD. And these are some of the traits that are more common in females with ASD. For example, a woman or a girl with ASD may dress more comfortably than in terms of keeping up with the current fashions. And they might be less interested in their appearance than neurotypical girls. Sometimes they might also be less likely to take care of themselves and forget to engage in hygiene. They might have an eccentric personality, and they can appear very youthful or act very youthful. In comparison to neurotypical girls, they may be more androgynous or might have like more of like a masculine side than neurotypical females, which can be common with people with ASD. They can be a bit more gender fluid than people who are neurotypical. Um, they will Females with ASD, they'll use books or TV as a means to escape when the outside world is getting too harsh. They can like a lot of structure. Like boys, they can be rigid with their routines. This is a way to help control their anxiety. Uh, they can enjoy a lot of time at home or being in a structured environment. They might not want to get out too much. Um, they can be very talented. They can be talented in music or art, or just they can be overall be very intellectually gifted. If they have a particular interest, they can be very passionate about it. Like they can get very passionately involved in social justice causes, and they could potentially turn this into a career. And they can be passionate about their career too. Um, they can struggle to find a job or to maintain a job. Or sometimes they might lose interest in their job. Um, they don't do as well with verbal instructions, and they understand things better when they can write things down. Um, they can be very emotionally sensitive, and they are prone to having anxiety and depression. Sometimes the anxiety and the depression, they're more recognizable than the ASD, and they can be more likely to be just diagnosed with anxiety and depression or bipolar disorder or borderline personality disorder or some other personality disorder. They can have some strong sensory issues. They can also be prone to having intestinal problems. They can be sometimes be perceived as being cold-hearted or unfriendly, and they can have a difficult time making friends or maintaining relationships, especially if they're trying to maintain a relationship or start a relationship with a boy that they like. If they start liking a boy, their attempts can be to get them to notice them can be very awkward or can be very off-putting. Like sometimes they can get overly obsessed with a boy that they like, and that turns them off. They also may prefer animals to people, and as I was saying before, they can have a special interest or a strong interest in animals. Now, there are many ways that ASD can affect women and girls, and there are many comorbids that women and girls with ASD can have. And some of this is just that perhaps genetically these disorders are just more linked to ASD, but also a lot of it stems from how society treats women and girls with ASD. For example, women and girls with ASD are much more likely to suffer from anxiety. They especially have a lot more social anxiety and agoraphobia. And some of this could be because they are picked on by other people like they're bullied by their peers. But also it's just related to autism itself. Um, and this anxiety can lead to social isolation. It can also cause depression, and that depression can eventually lead to suicidality, which is something that we as clinicians need to be mindful of. And there's also a common link between ASD in women and girls and eating disorders, such as anorexia and bulimia. And women and girls with ASD are much more likely to develop an eating disorder. And that is another thing that clinicians need to be mindful of. Women and girls with ASD, they're also more likely to be victims of abuse, and it's estimated that around 16 to 25% of people with ASD are sexually abused or have been sexually abused, and that is another thing that we need to be aware of, because women and girls with ASD, they can be more naive and less likely to pick up on certain social cues, and are more likely to fall the victim of a sexual predator or to be taken advantage of sexually by men. Now, what can we do to better help women and girls with ASD? There are many things that we can do and that professionals can do to better help women and girls with ASD. The most important thing that we can do is just be more aware that women and girls can have ASD. Don't buy into the myth that women and girls with ASD do not exist and that it's only a male disorder. And don't be fooled by a woman's more subtle behavior. That just because their symptoms are more subtle or less severe doesn't mean they don't have it or that they are not suffering. Um, Researchers need to further investigate ASD in women and girls. Also, clinicians and therapists, they need to be more creative when it comes to evaluating women and girls with ASD. Like, don't fall into the trap of thinking that they just have bipolar disorder or that they have borderline personality disorder. It may appear that way, but it may also be autism. And also, we need to be more creative in our treatments for women and girls with ASD. The same treatments that work for boys might not work for girls. For example, girls with ASD could use more group therapy treatment or more social skills training than boys with ASD. And they could use more social group interaction with other girls with ASD, or maybe have like a partnership with neurotypical girls that can help them to develop their social skills. And also, like, even when you have like a group therapy with boys and girls, um, try to plan some more girl activities, because sometimes like the group therapy skills groups, they can plan more masculine activities that alienate girls during group therapy. So that is my presentation. I hope that you enjoyed it and that you got to learn more about ASD in women and girls. And here are the references that I used for my presentation on women and girls with ASD.